Okay, thank you very much, Ira. Can you hear me?
Yes, I can hear you. Okay.
Right.
Yeah.
Okay, thank you very much to Ira for the very kind introduction, and to MyMedik for the invitation. I'd like to give a special thanks to my dear friend Dr. Saleh, who invited me today. I'd like to congratulate MyMedik for this program. I think it is a wonderful program. And from what I understand, all you listeners out there right now are either members of the public or medical students or young doctors, new doctors who recently graduated and waiting to be posted. So my task today is to share my experience with regards to my career, my specialty, and there's also for me a time of self-reflection and being thankful for whatever I've been through, and I hope to somehow or rather inspire all of you. And who knows, maybe among some of you, you might be interested in surgery, and particularly colorectal surgery, but especially after this talk. So just bear with me, okay? So now I have a few slides that I'm going to share, and after that, I understand I'll be very happy to take in some questions from all of you. Okay. Just going to share my screen. Okay. Yes. So how I'm going to go about this is basically answer these 5 very common questions. Who, what, where, when, and why. Who am I? And then what do I do? Where do I work? When am I needed? Basically, I'm talking about the kind of diseases that I deal with. And the last but not the least is going to be a little bit philosophical, asking myself and all of you why I did colorectal surgery. Okay. Now, who am I? Just to put things into perspective, because I'm sure some of you are probably half my age, or even some of you could be close to my age. But whatever I'm saying is based on my experience. And I'm currently, like what Ira says, I'm a consultant colorectal and general surgeon. I currently work in Pantai Hospital, Kuala Lumpur, but I have spent a large part of my career training, and then after that working in UKM, right? So I was there. So my journey, obviously, like all of you, I started in medical school, and my housemanship, I will show pictures later, but I did my housemanship, and then I was an MO for a while, and then I joined the master program. And once you're in the master's program, you're called a registrar. And then I finished that, I was a specialist, and then I did my subspecialty training, which is called the fellowship program. And now I am a consultant. Now the years there are not the years that I went through, but these are the years that on average, what somebody would go through, give or take a few years to become a consultant colorectal surgeon. So these are all young, thinner, younger pictures of me. When I graduated in 2003 in USM, probably those were one of the best years, and I'm sure those who graduated will understand. And then I went to do my housemanship in Alostar. Now at that time, housemanship in Alostar was in the old hospital. It was just a 1-year program, 1-year housemanship. Now I understand that most of you undergo at least a 2-year housemanship. So I did pediatrics, general surgery, and obviously the compulsory one is obstetrics and gynecology. And you can see here that I did not do orthopedics. I did not do orthopedics because at that time it was not required. So my experience with orthopedic surgery was just in medical school. And once I finished my housemanship, then I did 3 or 4 months in internal medicine, which was very useful. Sorry. Okay. Now, then after I finished my housemanship, I was actually sent to Baling. Okay, Baling is in Kedah, which is near Sungai Petani, actually very close to the Thai border. And I was there for about 9 months. Very interesting time also.
It's
Good experience.
it's my hometown, Doctor.
Oh, is it?
Yes,
Okay.
yes. This is we call. I think this is Clinic Landa.
Yeah. Yes.
Eh,
Well,
this is
actually,
Colorectal. Yeah, yeah.
yes, I was in colorectal, and then I moved to I can't remember I can't remember what it's called, but yeah, I was in colorectal, and I was taking care of the maternity and children's care. So I was doing a lot of ultrasound scans, and then I went to once a week. I used to go to a clinic somewhere right in the middle of the Kelapa estate, where patients would line up for you for a week, because they haven't seen a doctor for a week. Very interesting. They give you chickens lah. They give you lots of because they can't pay you in cash, so they give you a lot of presents because they're very thankful. And that was a very, very interesting time. So I spent almost 9 months there, but then I realized that I wanted to I wanted to become a surgeon, and being in clinic kesihatan, obviously that would not be possible. So I did a big decision, and many of you might come to this decision later on in your career, whether you want to proceed to do specialty training or not. Okay, so then I decided that one of the fastest way, and you can answer questions later on that, but I resigned from Kementerian Kesihatan Malaysia, KKM, and then I joined UKM, right? So I joined UKM in about end of 2004, and I was working as a trainee lecturer and a medical officer for about 2 years. And these are some pictures of me and my seniors. This is me at the end, but all my seniors here, they're all big-time surgeons now. And these are my closest friends. And in 2006, so you're talking about 4 years after my graduation from USM, I joined the general surgical training program. Okay, so the general surgical training program is for all of you who don't know, and things are pretty much similar, except that the entry requirements nowadays are a little bit different. I understand that you have the MyMedik exam that you have to sit, and then you have a series of interviews, which I was part of the interviewer. I was one of the interviewers before I left UKM. So, but it is a 4-year program, and the first year is really about being just introduction to general surgery. Then I did a bit of plastic surgery, a brief introduction to anesthesiology and ICU. And the second year mainly is a subspecialty training, so on urology, cardiothoracic, neurosurgery, pediatric surgery. Now, obviously, each of these postings is only about 3 months, so you cannot really learn much. It's just more of an introduction. And in year 3 and year 4 is as a master student, that's where the action is most, where you actually get to help assist in the big operations. And that's where I learned my first time, I'm doing hepatobiliary, vascular, colorectal, upper GI, breast and endocrine. And Alhamdulillah, I graduated in 2010. And then I became a general surgeon in 2010. Right. Then after that, then I proceeded with doing 6 months gazettement. Gazettement means it's like a trial period for new young surgeons before they actually get the license. So they actually have to go through a period of probation where your seniors or your head of department will confirm you whether you're fit to get the full license as a general surgeon. So then after that, I was at the crossroads. What should I do? So you can see here, I have a lot of choices. Once you decided to join surgery and you finish and you become a surgeon, there's so many options you can take. Number one, you could just continue being a general surgeon. You may choose not to decide to subspecialize, but I think in this day and age, if you have the opportunity, you should. I have here cardiothoracic, neuro, breast endocrine, hepatobiliary, so many. But I realized that I was more interested in abdominal surgery, abdominal work, and that really lessened my option to the ones in green. Okay, so at the end of the day, what you have is hepatobiliary, upper GI, colorectal, and urology. Now, I initially was interested in upper GI more because I thought that the surgeries were interesting. But at that time, sometimes your career path is determined by the circumstances that is around you at that time. And at that time, there was no senior surgeon in upper GI. So I couldn't go and learn upper GI if there was nobody to train me. And urology was a totally different ball game entirely. I had to leave general surgery. I had to go through a urology training program. And my boss here on the left, Professor Dr. Ismail Sagab, he was very nice. He approached me and he said, I know you want to do upper GI surgery, but I need an assistant in colorectal surgery, and they're very similar. So why don't you join me for about 6 months or 1 year? And if you're interested, you learn a little bit, and then you can go back to upper GI. Or if you're interested in colorectal, stay. So that's how I ended up in colorectal surgery. Okay, so then obviously once I was interested in colorectal surgery, I joined the training or the fellowship program. I will talk about that a bit more later. Okay. Now, when am I needed? Just as a reminder for all of you, this is our digestive system, right? And the field or the subspecialty of colorectal surgery is basically the large bowel and the rectum. So these are the anatomy of the organs that I deal with. Now, having said that, I'm a general surgeon, so I know a little bit about everything in the abdomen, but this is the area that I am especially trained for. Okay, now this is a picture of the colon and rectum, the entire colon and rectum, the entire colon which I removed, right? Now, what are the common diseases that I normally see? Well, the most common actually that I deal with is colon and rectal cancers. Talk about a bit more later. I deal a lot with other things other than the colon, like common diseases of the rectum, like hemorrhoids, anal fissures, abscesses. Sometimes I deal with things like diverticulitis, inflammatory bowel disease, and even patients with chronic constipation come to see me. So, I mean, I know a lot of you think, why would you want to spend a lifetime dealing with things that are smelly or things that are not very clean? But actually, it is even more interesting than that. And if you actually clean the bowel, you don't actually deal with a lot of poo or a lot of stool. So it's not as bad. It's not as bad as it sounds or looks. So this is a picture of a cancer that I've removed. You can see it's huge cancer in the colon. And this is another picture of that. And this is a picture of diverticulitis. I'm sure you all know this. And these are very common, especially in the elderly, and it can be a major source of bleeding. These are the huge hemorrhoids that sometimes I have to deal with, very painful, and these patients require urgent surgery. And there are many ways to deal with it. I'll talk about that later. This is quite common, though it's not well known. Anal fistulas, where you have an abnormal communication between the anus and the skin, mainly related to an abscess of the perianal region. And interestingly, general surgeons are not very experienced in this, and a lot of times colorectal surgeons have to deal with this, right? Of course, patients with rectal bleeding, investigations for it is something that colorectal surgeons do. And we also deal with emergencies like intestinal obstruction, patients coming with vomiting, abdominal distension, and of course, bowel perforation, sometimes due to trauma or to diverticulitis or perforated cancer. So this is something that we do in an emergency setting. Now, what do I do? So you know the type of diseases that I deal with, or that colorectal surgeons deal with. So what do we do? Well, these are the normal activities. Now, just like any other surgeon, we have a lot of activities. Like, of course, number one is surgery. It could be emergency, elective, or daycare. We also run clinics. Clinics, in private now, clinics are every day, but you're in a government, then maybe it's once or twice a week. And I also do colonoscopies, OGDS, upper GI endoscopies. Ward rounds, obviously, is a daily part of my routine. And then once a week, we have a tumor board where we discuss difficult cancer cases. And particularly for colorectal surgeons, for those who are interested, then you can also have a pelvic floor lab, which is later what I will show you. So I'm sure you all know what a colonoscopy is. All general surgeons or doctors who undergo general surgical training should know how to do a colonoscopy. Basically, it involves putting the scope into the colon from the anus all the way to the appendix. And this is the gold standard for screening for colorectal cancer. And this is what you might find. Having said that, not only colorectal surgeons do colonoscopies. All general surgeons can do it, but also gastroenterologists, if you are interested in internal medicine, but you still want a bit of action, then you can join gastroenterology. Now, what are the common surgeries that we do in colorectal surgery? These are some of them. Okay, I'll just show you some pictures. Now, I'm sure you all know this also in medical school. If we remove the right side of the colon, that's called a right hemicolectomy. So you actually, if you have a cancer on the left side here, sorry, on the right side, you remove the colon together with the blood supply and the lymph nodes, because then you can adequately stage them. If you remove the transverse, the distal transverse and the splenic flexure, that's called a left hemicolectomy. And if you remove part of the rectum, that's called an anterior resection. So interestingly, if any of you have assisted before, for example, if you remove the left side of the colon, you do a left hemicolectomy, you have to join back the bowels. You can either stitch or using this stapler. Okay, and similarly in the rectum, if you remove part of the rectum, you have to join back the rectum, right? Then you use a special device called a surgical stapler, put it up into the rectum in the anus, and this is how we join the bowels back. Pretty interesting. I wasn't aware of this when I was a medical student, obviously, but as soon as as you go along your career and you're interested, you will find a lot of new gadgets and new things that modern technology that we use to help treat our patients. These are the very, very big operations that we all start off with in called open surgery, laparotomies. Okay, this is the surgeries that I used to do, and you end up with really big scars. But once you be a bit more experienced and you have progressed in your training, then you go on towards doing laparoscopic surgery, or we call it keyhole surgery, where inside is essentially what I described to you, same, but outside the patients have much less scars, less pain, and the patients recover faster. Okay, so this is what we do. Now, obviously, in the modern age now, you have something called robotic surgery. Robotic surgery is when the surgeon is in a different room controlling the robot. You can see how the robot works here. Working in a tight space, it gives you more space to dissect away the tumor in the pelvis, especially with the ability to go in really tight spaces. Right, so now these are all the modern equipment that's coming up. Single port wound robotic surgery, where the surgeon controls the robot just to one hole, pretty much like a science fiction movie, isn't it? So it's something that I'm sure by the time you all are colorectal surgeons or surgeons, you will be dealing with more than me, obviously. These are very, very high-tech surgeries where sometimes from the anus, we perform removal of rectal cancers or polyps through the anus without a single scar. And this is what I used to do. And this is probably one of the first in Malaysia to perform this kind of surgeries. Patients have no scars at all. Other than cancer surgeries, these are all the hemorrhoid surgeries that we do. There are a lot of hemorrhoid surgery. There's using the stapler device here, use the laser, and then this is the usual cutting, the usual hemorrhoidectomies that we perform, right? And sometimes when you want to treat the rectum, especially when it comes to fistulas, there are a lot of other surgeries which I won't go through now. If you're interested in pelvic work meaning in things like constipation, knowing what causes constipation, then there are other tests you can do. This is called an anal manometry. It looks at the pressures of the rectum. This is only colorectal surgeons do this. No other general surgeons would be trained in this. And then we also use special device like this endoanal ultrasound to study the wall of the anus and the rectum to see different kinds of cancers, how deep the cancers go. And these are all pretty interesting things that I learned in my training as a colorectal surgeon. Of course, other than the usual work, when I was a lecturer, I used to do a lot of academic work. So published quite a few papers with my friends, grants, and I was also involved in the formation of the undergraduate curriculum of third-year medical students in UKM. So, it's not only about clinical medicine, but you also get to do a lot of things. I used to train undergraduate students, postgraduate students, and also I train general surgeons in the field of colorectal surgery. So as a surgeon, as a doctor, there's a lot more than just treating patients. And you will, as you progress, you will realize that you should not just confine yourself to one aspect of medicine. Now, where did I work? Okay, so this goes to the question of the colorectal fellowship program. Now, in Malaysia, the colorectal fellowship program or the colorectal subspecialty training is run by the Ministry of Health, Malaysia. Okay. Now, if you look at general surgical subspecialty, colorectal surgery is probably the most organized. Organized meaning they have a program, they have a curriculum, they have trainers who have applied for accreditation to run this program. So it starts off with an entrance interview. So when I was interested in colorectal surgery, Dato' Ismail, my boss, asked me to go for the interview, and then the interview is run by senior doctors, senior colorectal surgeons from KKM, from the universities, mainly UKM, UIA, USM, and also from the Malaysian Society of Colorectal Surgeons. So it's a 3-year program. It's 2 years has to be done in Malaysia, and you must be under the minimum of 2 different consultant surgeons. Okay, and then 1 year you have to go overseas to do your to continue. So you can either go to anywhere in the world, from Europe to America to Asia, South Korea, Thailand, even nearby like Singapore. And you can choose to do a research fellowship where you just do publications, or you can do a clinical fellowship like what I did. I'll talk about that later. And then when you come back from the training, you undergo an interview where there is a viva voce, where they ask questions, they look at your logbook, and you must publish at least 2 publications. Every year they take about, well, from what I understand now, 3 to 6 candidates, sometimes more. But colorectal surgery is a very, very popular subspecialty, and a lot of general surgeons apply for it because it's something very relevant. And at the end of the day, it's a very interesting thing. And thankfully, the people who are in colorectal surgery are all very nice people. There's not much internal politics, and things are very pleasant. So these are the training programs. Now you can see here, there are not many colorectal surgeons in the country. And in fact, these are the places where one can train in colorectal surgery. Kota Baru Hospital, Kuantan, okay. Johor Bahru is very new. And then obviously in Seremban, Alostar. You can see Sabah and Sarawak does not have any training center. In fact, there are only two colorectal surgeons in the whole of East Malaysia. Okay, one in Kuching and one in Sabah. Both are my good friends. And of course, in KL, there are quite a few places you can train in UKM, Selayang, and Hospital Kuala Lumpur. Sorry, Hospital Kuala Lumpur is not a training center, but UKM, and Selayang. Right, so these are the places that you can train in KL. So where I trained personally, I went to Hospital Tunku Jaafar in Seremban for 6 months. And then I continued on in UKM for a year under my boss. And then I went for 6 months to Hospital Tunku Ampon Afzan in Kuantan, where I trained under Prof. Azmi from UIA. And then my final year, I went to the Royal Prince Alfred Hospital in Sydney. So this is the hospitals that I went and I thoroughly enjoyed myself. It's good to get out of, it's good to work in a few places so that you learn different cultures, you learn from different bosses. You take the good things and you try to avoid all the negative things or that you see. And then my final year, it was the best time of my training program. I spent a year in Sydney, where I was at the world famous Royal Prince Alfred Hospital. I was a clinical fellow, so I did everything. I did houseman work, I did MO work, I did registrar work, I did specialist work, all in one as one person. And I learned very, very big surgeries. These are huge surgeries called exenteration surgeries, where we remove a lot of very big tumors. We have huge, big wounds. And I also made lots of good friends among my colorectal fellowship and nurses. And these are my house officers when I was in Sydney. Now, once I came back, I finished the interview, I fulfilled all the criteria, then I passed. And this is some of my colleagues who passed, and this is their ceremony where they got this certificate of completion of their fellowship program. Okay, so in summary, I finished my undergraduate in 2003. I became a surgeon by 2010, and I became a colorectal surgeon in 2015. And once you finish your training, then you can apply. All specialists in Malaysia must apply for the National Specialist Register, and whether you're a general surgeon or a subspecialty surgeon. So currently, I am a colorectal surgeon in Pantai Hospital, Kuala Lumpur. I also practice in Arada Mansara Medical Center in Subang, the Beacon Cancer Hospital in PJ, and I am licensed to practice in Oriental Straits Hospital in Malacca. So it comes to the last part of my talk. Why? Why do I want to do colorectal surgery? Okay, let's start with statistics a little bit. Colorectal cancer is the most common cancer in men, and the second most common cancer in women after breast cancer. Okay, in fact, the statistics say that 1 in every 56 men and 1 in 74 women in Malaysia will get colorectal cancer. It is so common that it is frightening. And another reason why I like to do colorectal surgery is because when you're treating these sort of cancers, you don't only work alone, you work with a lot of other colleagues from different specialties, like oncologists, liver surgeons, gynecologists, urologists, pathologists, radiologists. So there's so many people who are involved in the care of colorectal cancer, and I like working in a team. And the challenges of operating in this type of surgery is not easy. If you can imagine, the male pelvis is almost as big as a Coca-Cola can. And if you have a rectal cancer here, it's not easy to want to remove it, right? So that's where I showed earlier the use of robotic surgery, the use of technology. All these are all new things which I found very, very interesting. And of course, at the end of the day, the best feeling is to get your patients to appreciate you and to see that they have recovered, that they are cured, and that is the best feeling. And I'm sure all of you have treated patients will experience that. So as I said, with this huge burden of colorectal cancer disease, there are not many. There are only 50 colorectal surgeons in Malaysia. Only 30 are, a big majority of them are in KL. Only 2, as I said, in Sabah and Sarawak, and most of them are in private practice. But it is a big burden, and I think there is a lot of space for us to take in more colorectal surgeons. And of course, once you're experienced and you become a consultant, you get invited to speaking engagements in Malaysia and in overseas. You get to attend a lot of conferences, make friends with a lot of people, and you collaborate with a lot of international organizations. Here I am, I'm part of the European Society of Colorectology Global Reach Committee, where we try and talk about latest updates in colorectal surgery in the world, try to update people, bringing together people from Asia, Europe, and South America especially. And then you also work together with the industry to improve on the quality of healthcare. So these are all the things that I did Of course, once in a while, you get invited to write an article or go on the news, and that's pretty interesting. And guess one of the perks of being a colorectal surgeon. And you get to work with a really good bunch of people. This is the Malaysian Society of Colorectal Surgeons. We have about 60 members. And our annual scientific meeting is probably one of the biggest events in general surgery every year in Malaysia. And if any of you who choose to want to join, you can join. Every year it's on. There are special prizes for junior doctors or medical students. And also, I was the former treasurer, and currently I'm the vice president, and I will be the president in a couple of years. Right, so I've answered the who am I, what do I do, where do I work, when am I needed, why do I do colorectal surgery. I've talked about a colorectal fellowship, how do you get into the program. So some of the parting words I'd like to say is, you know, nothing comes easy. You got to work hard. You have to be resilient. Don't give up so easily. Try to, I mean, of course, when you start to begin, you can never really be truly independent, but you aim for that. You ask questions, don't be shy. And one of the things that I realize is don't complain while you're in training. Obviously, if things are really bad, then you should talk to your seniors or to your bosses, but don't complain too much. Be humble and do only what you are passionate about. I mean, don't get forced into something. I mean, if you're not interested in colorectal surgery, for example, don't force yourself to do it. Okay, because then you won't last in that program. These are my trainers, which I'm eternally grateful for, because without them, then I would not be where I am. Right. So thank you. Good luck, and I'd like to take some questions from any of you.
Okay, thank you so much, Dr. Lukman, for the very amazing lecture. That was indeed very informative and very inspiring, I must say. And I'm sure the participants gained so much from this session, and maybe can learn some new things just now. Okay, so now for the Q&A session, those